House Bill 1314. Imagine this. You're about to schedule a routine knee surgery. Before you agree, you ask how much it'll cost. The hospital promises to send you a written estimate, but when the final bill comes, it's thousands higher than expected. You call for help and discover there's no clear state rule limiting how far off the estimate can be. What the bill says it does? House Bill 1314 says it gives Texans the right to a written price estimate before scheduling any non emergency elective medical procedure. It's meant to help patients understand potential costs and avoid surprise bills. What it actually does. The bill guarantees that hospitals, surgery centers, birthing centers, and freestanding ERs must email an estimate within 5 business days if you ask for one. But the earlier version of the bill would have capped how much the final bill could have exceeded that estimate within 5%. That protection was removed. Now, instead of hard limit, you just get a notice explaining how to file a federal dispute if your final bill is $400 or more above the estimate. Who benefits? Hospitals and surgery centers that keep flexibility in billing, insurance and benefits administrators who want standardized estimate rules, lawmakers who can claim a transparency win without adding strict enforcement. Who pays the price? Patients who don't know they must request an estimate. People hit with large billing surprises who must fight it out through federal paperwork. Texans who lose the state's public consumer guide to healthcare repealed by this bill. Why it matters. Healthcare costs are already unpredictable. This bill gives Texans a right on paper, but not much power in practice. Without a state level cap, audits, or public price comparisons, families still face uncertainty and the burden of policing over their own bills. Questions you can ask your lawmakers. Why remove the 5% price cap that would have protected patients from major billing surprises? How will Texans know about their new right to an estimate if the state no longer provides a public guide? And should the legislature require audits or public reporting to make sure facilities follow the rules? Bottom line, House Bill 1314 looks like transparency, but without real limits or oversight, it mostly protects the people sending the bills, not the ones paying them.